It is important to take blood samples in different types of blood sample tubes because each tube is designed to support specific types of tests and ensure the quality and accuracy of the results. The differences between tubes lie in the additives they contain, which can influence the way blood is processed. Certain additives or the absence of additives are necessary to preserve the integrity of the analytes being tested. Blood culture bottle is used for the sodium polyanethol sulfonate, anticoagulant, and growth media for microorganisms. Light blue color lid test tube contains with sodium citrate, weak calcium chelator anticoagulant additive. Plain red color lid test tube is no contain additive. Gold, sometimes red and gray, tiger top, color lid test tube is contained clot activator and serum separating gel additive. Orange color lid test tube is contained clot activator and serum separating gel additive. Dark green color lid test tube is contained with sodium heparin, anticoagulant, additive. Light green color lid test tube is contained with lithium heparin, anticoagulant, plasma separator gel additive. Lavender, purple. Color lid test tube is contained with ETA, chelator, anticoagulant, additive. Pink color lid test tube is contained with K2 ETA, chelator/anticoagulant, additive. Royal blue, navy, color lid test tube is contained with EDTA, chelator, anticoagulant, additive. Tan color lid test tube is contained with sodium ETA, chelator/anticoagulant, additive. Gray fluoride oxalate color lid test tube is contained with sodium fluoride, glycolysis inhibitor, potassium oxalate, anticoagulant, additive. Yellow color lid test tube is contained with acid citrate dextrose A, anticoagulant additive. Pearlescent white color lid test tube is contained with separating gel and K2 ETA additive. Black color lid test tube is contained with sodium citrate additive. Quantiferon gray, green, yellow, purple color lid test tubes 1. Gray tube contain nil additive 2. Green tube contain TB1 antigen additive 3. Yellow tube contain TB2 antigen additive 4th. Purple tube contain mutagen additive. Now we're going to talk about its uses and comments. Blood culture bottle. Sodium polyanethyl sulfonate. Usually drawn first for minimal risk of contamination. 2 bottles are typically collected in one blood draw, one for aerobic organisms and one for anaerobic organisms. Sodium citrate, weak calcium chelator, anticoagulant. Additive is used for coagulation tests such as prothrombin time, PT, and partial thromboplastin. Time PTT and thrombin time TT. Tube must be filled 100%. No additive tube is used for serum, total complement activity, cryoglobulins. Clot activator and serum separating gel additive is used for serum separating tube SST. Tube inversions promote clotting. Most chemistry, endocrine, and serology tests, including hepatitis and HIV. Clot activator and serum separating gel additive is for rapid serum separating tube RST. Sodium heparin anticoagulant additive is used for chromosome testing, HLA typing, ammonia, lactate. Lithium heparin anticoagulant. Plasma separator gel additive is used for plasma. Tube inversions prevent clotting. EDTA, chelator anticoagulant, additive is used for whole blood. CBC, ESR, Coombs test, platelet antibodies. Flow cytometry, blood levels of tacrolimus and cyclosporin. Ketadu EDTA additive is used for the blood typing and cross-matching, direct Coombs test, HIV viral load. EDTA, chelator anticoagulant, additive is used for the trace elements, heavy metals, most drug levels, toxicology. Tan color lid test tube is contained additive of sodium EDTA for lead. Fluoride oxalate additive is contained with sodium fluoride, glycolysis inhibitor. Potassium oxalate anticoagulant for glucose, lactate, toxicology for testing. Acid citrate dextrose A, anticoagulant additive is used for tissue typing, DNA studies, and HIV cultures test. Separating gel and K2 EDTA additive is used for PCR for adenovirus, toxoplasma, and HHV6. Black color lid test tube is contained with sodium citrate additive for pediatric ESR test.